to the latest of the Boxer Advisors webinars. This session is a little different, and I think all of us would agree that there's a new normal around work. And so I was actually on Friday, I was talking with my sister, and Sarah, can you hear me okay?
Yes, I can hear you.
All right, excellent. And she was asking what was the impact of the coronavirus on our business. And her husband, Les Robinson, she said, well, maybe Les could do a webinar for you. And so, so we are going to do this session today. And this session is for clients. And then we're going to host another session at 4 p.m. Today for our colleagues. And so the purpose of this session is to do three things. One, Les is a long-term, I'll say a little bit more, but he's an infectious disease doctor. And so he'll talk to us a little bit about the medical implications of the coronavirus. Then I will talk a little bit about what are we doing for our team, and what are some ways that we can support our clients. And then what we'll do is we'll open it up for questions and if people have best practices. And so let me welcome Leslie Robinson, who, as I said, is an infectious disease doctor. He lives in Phoenix, Arizona. He happens to be my brother-in-law, and I'm really grateful that Les is able to be with us today and provide us, as I was saying to one of my colleagues earlier today, Les has forgotten more than I'll ever know about infectious diseases. So Les, welcome, and I'll let you say a little bit about yourself.
Thank you, Kenny. As Ken said, I'm an infectious disease specialist. I have been in practice for approximately 37 years. I received most of my training at Emory University in Atlanta, Georgia. I then did my fellowship training here in Phoenix, Arizona, moved to Los Angeles, where I was in practice for 7 years, moved back here and have been in practice ever since as in private practice of infectious disease. I've also managed infection prevention program for several hospitals in the area over the course of that 37 years, and set up one of the first antibiotic stewardship programs here in Phoenix, Arizona as well. So that's kind of where I'm coming from. And if you want to start the slideshow, I guess we can go from there.
That's great. Thanks, Les. So before we dive in, a couple of things. One, if people have questions, there should be, there'll be three opportunities for people to ask questions. One, we are going to have some polling questions to engage you in the conversation. Second, everyone should have, for me, it's at the top of my screen. There's a little control bar, and for you, it should say either Q&A or chat. And so if you have questions for Les or for me, you can type them in the chat bar. What we'll probably do is we've reserved about 10-15 minutes for questions. And so if you have them, either Les or I will try to handle as many as we can do during the session. And then if I know for me it happens, maybe not for you, but sometimes when I'm on a webinar, I think of a question afterwards. I said, oh, darn it, I wish I'd asked that. If that happens, we're going to give you my email at the end of the session, and you can just send me an email. And if it's for Les, I'll forward it to him. He'll answer and I'll send it back to you. So those are some housekeeping details. We do have another colleague on the video conference today, Sarah Witt. Sarah, are there any other logistics, housekeeping details you think I need to mention, or are we good?
Just mention that if you can't find the toolbar, it's probably at the bottom of your screen, and the chat button should be flashing because I just sent everyone a chat. So we'll be putting information in there as we go. And if you have any questions, you can also put them in there.
That's great. All right. So let's get underway. So before we dive into, so again, the way it's going to work is Les is going to provide some information to us on the medical implications of the coronavirus. And then I'm going to talk about what we're doing for our team, what we can do to support our clients. But before we get underway, we'd like to launch our first poll. So one of the questions, again, this is your session. So we wanted to get a sense of what are you hoping to learn? So we'll leave the poll open for another 25 seconds. So we'll go ahead, Sarah, and close the poll in 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. All right, let's go ahead and share the results. So Les, I don't know, can you see that?
Yeah, I can.
Yeah, so about 50% of people say, what can I do to take care of myself? Not surprising. That's a you issue, Les. Another 50%, what are the symptoms? How do you treat it? 100% of the people wanted to do that. And then what are some strategies to deal with this? That's a me issue. So I think that we will be able to address all of your issues. Again, we're going to try to go through this quickly so that we end at 3:55. But if there are some questions that we don't answer, you can bot me an email afterwards and we'll do our best to respond. So with that, I know we've got sort of an interesting collection of we actually have some colleagues on the video conference and some clients and some people who are new to us. So what I thought I'd do is talk a little bit about Boxer Advisors. So our mission is to create and deliver effective coaching, consulting, and training solutions to help our clients meet their needs, ultimately by bringing the right solution to the right client at the right time. And we believe that one of the secret sauces to help us do what we do is strategically integrating what we're doing into to support some of the things that our clients are doing. And when we do that, we're able to see some measurable return on investment. The three things that we do, we help build leadership capabilities, we help drive organizational change, and we help our clients to engage and retain top talent. Obviously, all three of those are pretty relevant given everything we're dealing with this pandemic. So that's a little bit about us, a little bit about housekeeping details. And so what I'm going to do is I'm going to turn it over to Les to talk about what is he seeing with this pandemic, what are some of the medical implications, and what can we do to take care of ourselves and our loved ones. So Les, I'll let you take it from here.
All right. Well, Kenny's already put up the first slide, and unfortunately, this is already a week out of date. And so the bottom line is from March the 12th until today, we now have about 1,800 cases, more than 100 deaths. And I don't know how prevalent this is in your area, Kenny. In Arizona, this says 9, but we have about 12 cases now. no deaths. They're mostly located in the Phoenix and the Tucson area. Next.
So one of the things that we want to do is understand what are some of the challenges that you're facing in dealing with the coronavirus. So Sarah, if you can launch the second polling question, that would be great. All right, so we'll keep this open a little while. So if everyone can vote, that would be grand. So someone did have a question, and the answer is yes. If you send me an email, we're happy to send you a copy of the slides. Absolutely. So we'll end the poll in 5, 4, 3, 2, 1. All right, Sarah, if you can end it, that would be grand. And let's take a look at the results. So, so we had 25% that said we've got people sick. How do we take care of them? 100%. How do we manage teleworking? You know, our staff's trying to deal with children who are home. What are some things? I know there's, you know, we just heard, you know, in the president's press conference about different things that they're saying about millennials. You might have some thoughts about that, Les. And what are some ways that you know, we can keep our people safe? And then the last thing is, you know, how do we address some of the challenges of delivering training? So the last one I can do. The rest of them, I would say, Les, those are on you. All right. So I would say, to the extent that you can address those items, that would be grand. So I'll, let's see, I think I should be able to figure this out. So I think you're up.
All right, hang on 1/2 sec. Okay. So updated numbers as of last night. Nationwide, we've seen about 5,838 cases. Part of the problem is that this country, we're way behind the curve. Testing was delayed. The initial batch of tests that were sent out by the CDC turned out to be faulty and had to be sent back. They are starting to get everything ramped up. So what you're going to see to some degree is a catch-up with regards to numbers. So the numbers are going to rise exponentially, but part of that answer is, instead of doing only a dozen tests a day, we're going to be in the thousands and then hopefully tens of thousands of tests daily. So those numbers of confirmed cases will rise significantly. As of last night, we did have 107 deaths. 30 of those were in a skilled nursing facility in Seattle, Washington. But that's going to start skewing away from that small cluster. And I think we'll probably see multiple clusters for patients who are in nursing homes or otherwise closed scenarios. I saw an article in the New York Times this morning about the prison system, and that's going to be a major issue as well. As of today, all 50 states, Washington, D.C., and most of the American territories have reported cases as well. Arizona, I know this is not relevant to you, but we do have 63 pending results, 18 confirmed cases as of last night. I believe we're up to 20 as of this morning. Worldwide, 190,000 confirmed cases. Most of these are coming from the initial reports out of China, but that may be an understatement because of the Chinese government. There are 7,517 deaths, or for a conglomerate mortality rate of about 3.9%. Now, when we look at the big numbers overall, what you're going to see is that this mortality rate will eventually drop. We don't know exactly where it will be when you start counting in all the patients who are tested as we ramp up the testing. The CDC is saying they expect somewhere between 1 and 2%. I also saw comments earlier about we should be focusing on those who have recovered. We only know of 80,000 reported recovered. But if you've got 190,000 cases and only 7,000 deaths, you can see that there's a large group of people who are ill and have neither officially recovered or obviously have died. So next. Next slide, Kenny.
Yep.
All right, so what is this virus? Well, coronavirus has been around forever. For one thing, it has been the source of the common cold, but this is a rather different version of the virus that we generally see on a day in, day out basis. Other variants of coronaviruses have included the SARS virus from about a dozen years ago. This fortunately did not spread and become a worldwide epidemic. It turns out it was very difficult to transmit from person to person. Many of you may not be aware that there was a second SARS virus, if you will, called MERS. This showed up in the Middle East, so MERS means Middle East Respiratory Syndrome. It too was a variant of the coronavirus, similar to the SARS virus. The SARS virus was documented to have arisen originally from bats. The MERS virus, ironically, was from camel. And these two viruses are not the same as the current coronavirus, the COVID virus. Again, we suspect in this case bats, again, but other animals may be involved. Next. So you may see this term persons under investigation or PUI. So this is a very basic description of what this stands for. So anybody with fever, symptoms of lower respiratory tract infection, and any person involved either in healthcare, close contact with somebody documented to be positive within 14 days of onset. Fever, lower respiratory tract, and a history of travel from an affected area within 14 days, or fever with respiratory tract infection requiring hospitalization even in the presence of no source exposure. So that's what this term, persons under investigation. They may have had testing done. We may be waiting for the testing, or there may not be testing available in some cases. Next. Symptoms start off fairly typical, mild to severe respiratory illness, similar to the common cold. Fever is generally elevated. Above 101, it's usually not very severe, at least not initially. A new onset cough, as opposed to somebody who has some chronic cough or other related illnesses or problems. So new onset cough and difficulty breathing. Now, some of you may have heard this statement, I guess it was Geraldo Rivera went on Fox News and said, if you can hold your breath for 10 seconds, you don't have coronavirus.
I know that's not true. That's not true.
Not true. Absolutely not true. What that would pretty much imply is, well, at least at this particular moment, you don't have severe respiratory embarrassment. Doesn't mean it won't progress and you won't get into more problems later on. So again, the risk of transmission, fortunately, is relatively low, except in closed populations like nursing facilities. Next. So here's another look at the fever, at the symptoms. As you can see, fever occurs in about 88%, dry cough in about 68%, fatigue in about 38%. This is all pretty standard for the common cold. Fatigue, like most viruses, can be prolonged, and once you get over the virus, it may take a while to, sort of get back to your normal. Sputum production is generally thick mucoid, maybe discolored, usually yellowish. If it's very highly productive, if you're coughing up a lot of sputum, if it's more than just yellow, that may be an indication of pneumonia, maybe an indication of a secondary bacterial pneumonia on top of a virus as well. Shortness of breath obviously is going to be an issue for patients with pneumonia due to the virus. Muscle or joint pain, non-specific. Sore throat, non-specific. Headaches, chills, nausea, vomiting, nasal congestion, all very non-specific symptoms of almost any viral infection. Diarrhea, about 3.7%, which basically tells me that in most of us, all we need is no more toilet paper than you would normally go through in about 2 weeks to be stocked up. Next.
Hilarious.
So right now, what we're talking about are what are the measures to mitigate the impact of the pandemic. So initially when they came out, they said no large gatherings, then it was no more than 500, then 250 people, then 50 people, and now most recently they're saying 10 people. Again, this is because the more you pack people in together in a closed area, the more likely you can get transmission. One of the things that every time that I see this on television, I have to roll my eyes, I have to look away, but you get 17 people crowded around the president on a stage talking to the public and saying 6 feet of distance between you, and yet here they all are, including Dr. Fauci, up on this stage. So social distancing measures work. And the reason they work is because you're reducing the likelihood of somebody's cough or somebody's sneeze transmitting the virus. Most of these droplets are from lower in the airways, and they don't go as far as, for say, the ultrafine droplets that you get with some other respiratory viruses. Closure of schools, obviously for the same reason. Next.
So what we want to do next is launch our third polling. So, what Les has done is sort of created a picture of what's going on in the United States. He's going to talk about what can we do. And so we wanted to get a sense of what are you doing to deal with this? So again, we'll keep the poll open for about 25 more seconds. All right, we're going to close the poll in 5, 4, 3, 2, 1. All right, Sarah, let's go ahead and close it. So, not surprisingly, 50% less are updating their emergency preparedness plan. I know many of our clients are looking at that. They're trying to identify places to take care of sick people. Just 17% said that, but 83% said we're changing our communication strategy to let the team know what they can do and can't do it during these times, and taking actions to either postpone, cancel events. Not terribly surprising. I'm assuming, Les, that's not a shock to you?
Not at all.
Not at all. Okay. So then let's take a look at, I think, what can we do? So I think that's our next slide. Yes, Les, is that right? Yep. Did I do that right? Okay. Whoops, sorry.
So, yep. Protection measures, wash hands for 20 seconds. Now, I guess the one thing about not having any video here is I can't actually demonstrate the proper way to wash your hands for 20 seconds. But it's not just washing the palms of your hands. You need to wash the palms. You need to wash the tops of your hands. You need to get in between the fingers. You need to get in between your thumb and your fingers. And you need to get the wrist, the first part of the wrist, say about one fist worth above your wrist area in that 20 seconds.
Hey,
Obvious,
hey, Les,
yeah.
if you have, I don't know if you do, if you have a video on that or some graphic that you can send me, if anyone's interested. I know Les the other night, he showed me what he's talking about, and so it obviously the medical profession tells us you got to wash thoroughly. So if you have that, Les, great. If not, I'll let you continue.
Kenny, I would say I'll look for something, but my guess is in this day and age, if you go Google YouTube,
Gotcha.
I'm sure you can find plenty of YouTube videos on how
Yep.
to properly wash your hands.
Perfect. That's great.
Okay.
Thank
So
you.
next, I think it goes without saying, avoid contact with anybody who's sick. If you're sick, stay at home. If you're mildly ill, contact your health provider. I know in my office, I'm only seeing like one patient every 45 minutes to an hour. We only have one person in the waiting room at any given time, but that's because of the nature of what I actually do in an office. A neurologist who shares space with us sees 30 patients in a morning and cancels everybody. So we're telling everybody to stay home and stay away from the hospital. If you have to go to the hospital, a lot of places are saying, call us, sit in the parking lot. If you're really sick, we'll send somebody out to you. So keep that in mind. Disinfecting surfaces, bleach wipes will work. Excuse me, Lysol or a weak bleach solution. That's basically a 10% bleach solution. You can make with just plain water. Cover your cough and sneezes. I just coughed into my armpit. Avoid touching your face, eyes, nose, and mouth. Mucous membranes, you get the virus on your hands. You touch your eyes, you touch your nose, you touch your mouth. It gets in through the mucous membranes there. It doesn't get in through your skin per se. Face masks are not necessary for you unless you're sick to prevent spread. Next. So we don't have a movie, but this demonstrates the hand washing.
Next.
Next.
Got it.
So just a quick one, case fatality of the seasonal flu. You can see that this is going to be a lot more of a problem than the seasonal flu. Even though more people will have the seasonal flu, your overall mortality rate is about 0.8% to 0.1%, although it does increase with age. And you can see the same thing for COVID-19. Next.
This is
So,
this you've seen all over.
yeah, so basically what this is if without all these prevention, you're going to have that really high peak. And that's what we're concerned about, is overwhelming the healthcare system, that you'll have more people sick, more people in the hospital, more people needing ICUs than we have room for. So you're trying to flatten that curve, spread it out so fewer people need to go to the hospital at any given time. That's the goal and what this demonstrates. Next. So basically you can see here that this is just simple mortality rate. The highest was in the first two areas reported in Wuhan and then the Hubei province surrounding Wuhan. But with their rather draconian measures, they were able to tamp down the mortality rate, because what they were doing was flattening that curve, locking people down, and preventing the spread of the virus to other people. Next. Most important is don't panic. I got a kick out of, here's somebody, they've got an 80-pack of Charmin. There was a line outside of a drugstore this morning. People were going in and coming out one at a time, and they were coming out with 48 packs of toilet paper for about 20 minutes before they sold out and had to start restocking again. Everything else, you just need to have enough for 1 or 2 weeks at most. Next.
Les, is that you?
No, it's not me. It's just a generic picture online. Those of you who know Kenny likes to do top 10 things. So the top 10 things to do during your home quarantine. Next. Just to help you keep from going crazy.
That's great. That's great. I think it's a great list. I wish I had done it. So I think if I'm following what you're saying, Les, is it sounds to me, obviously there's some things we can't do. And I know, again, Les, my son and I have our annual excursion to the Frozen Four, which was supposed to happen in Detroit. That's not going to happen this year. So you've listed things we can't do, but I think, the things that you've listed, I think are smart things to manage the emotional side of this, which I think are relevant. I would say. Again, someone asked around the slides if we're going to give you my email address at the end of the slides, and if you want a copy of the slides, just send me an email. We'll send them out to you. So what I want to do is I'm going to cover a little bit about what we're doing to address the coronavirus. I'm going to talk a little bit about what we are doing and can do to help our clients. And then what I'll do is open it up for questions. So again, if people have questions, you can start typing them now in the chat bar, and we'll try to deal with as many questions as we've got. So Les, that was very, very helpful. Thank you. So I do think when I thought about, action, one of the things I think we need to remember is staying home does save lives. I know it seems a little draconian, but I do think at the end of the day, it will help all of us stay healthy. And then I saw this, I think this was a quote from one of the guys who was in the administration, is no longer. And he says, if we work together, this terrible moment could be our finest hour. And so if this coronavirus provides us an opportunity, while we may have social distancing, to come together and work together, I think it could be a demonstration of A, our resilience, and B, our ability to collaborate and coordinate and communicate with one another. And so some of the things that we're doing internally are, we're checking with our team, all of us, all of the Boxer advisors, client services folks, all work virtually. So, Sarah, who is serving as our erstwhile webinar administrator, she lives and works in North Carolina. So one of the things that we did is we checked in to make sure people have the supplies that they need. A number of our folks, including Sarah, have got young kids. And so that's one of the things we did early on. Again, thanks to my sister, we decided to host this webinar to provide information not only to our clients, but I've invited all the members of our team to log on to the webinar to learn about what Les was going to say about how to deal with this pandemic. As I mentioned, we're hosting another webinar at 4 p.m. for our colleagues to talk about what are some things that we can be doing to better support our clients. You know, obviously with kids being out of school and may be out of school for a long time, the third thing we're doing is confirming schedules. And so, you know, one of our colleagues who, you know, is working on some of our proposals, Sarah, Kayla has, I think, 4 kids. Is that right?
That's correct. Yep.
Yep. So, you know, 4 kids being out of school, you know, she told me she was doing a virtual yoga class yesterday, and she's having to adjust her schedule to take care of the kids. The other thing we're doing is I posted some articles that I was aware of. Les has, you know, communicated with me an article too that he liked. Sarah, just because she's always on the internet, she sent me a couple of articles. So I think we're just trying to be as smart as we can be about the coronavirus and what we should be doing and not doing. Obviously, we're checking with our clients. I would say starting on Thursday through today, I probably have had 24 conversation emails with clients trying to figure out whether we're going to continue business as usual or, you know, we haven't lost one piece of business yet, which, you know, I'm knock on wood, I'm pleased with. We did have one client that we had scheduled a team building session to be delivered next week, and they have postponed that. Some clients have decided to move some of the training that we were scheduled to deliver from a face-to-face modality to a virtual modality, and so we're doing that. The next thing we're developing contingency plans for the business and how we can manage through the downturn. And one of the things I'm doing, and Sarah, I think you can help me with this, is I have heard on the news that, you know, with kids being out of school, you know, one of the ways that either homeless kids or kids that maybe are impoverished get food is through schools. So with schools being out, you know, food banks are a source to provide food to not only children, but families. And so I thought that's one of the things that we can do to be of service to our community. So those are some of the things that we're doing internally with our team. So one of the questions I had, which Sarah, if you can launch I think this is a poll. Is that right?
That's correct.
Yep. So if you can go ahead and launch the poll. The question we had is, what are some ways that we can support you at this time? Whoops. I don't see the poll. I might be missing something. Is it a poll, Sarah, or have I lost my mind?
It is a poll and it is up. I'm not sure if anybody else can see it either. It's available.
Yeah, I cannot. If I can ask everyone, if you can just type in the chat bar, I can see the poll or I can't.
Let me see if I can relaunch it.
Okay, all right. Thank you, everyone. Sarah, should I? Oh, there we go. Look at you. So again, I wanted to get your all's reaction. What are some ways that you think we can be of help to our clients? And we'll close the poll in 10 seconds. All right, why don't we go ahead and close it? So let's take a look at this. 100% said moving training. I assume, that was supposed to be delivered, face-to-face to virtual. A number of people said, conducting virtual meetings, sort of focus groups. That's interesting. I'm going to say more about our executive book club, virtual coaching, and a menu of tools. All right, let me try to the extent I can quickly, talk about what we can do. So, so one of the things that we are doing is we are exploring with our clients, and I would say, Sarah, I think this is right, that there's not one training session that we're under contract to provide now that we can't move to a virtual environment. Is that right?
That's correct.
Yep. So some of them, I know sometimes people think about remote training, and I know, frankly, typically, when we think about remote training, we're thinking about it in 60, 90-minute bites, but we can, we have done it, is that, in sessions that are number of days. So we can do that. We are being flexible with client requests if they need to postpone services. We understand that. One of the things I think we can help our clients with, and if this is of an interest to you, let me know, but I have run a remote company for 28 years. We know a lot about how to manage a remote workforce. And so if you would like to have more information about how to do that, we've done some training for some of our clients. We can do some consulting, but I think we can help you. One of the things that we can do is we can host virtual sessions for clients. So if you're an environment that you want to get some feedback from your employees about what's working, what's not, what can you do, we can, we've got a team of consultants that can easily facilitate those listening sessions. One of the things that I'm proud of is we have access to a lot of coaching resources. We have about 40 executive coaches. We've got about a dozen action learning coaches. We've got, I think, 10 career coaches. And many of those people who provide those services, I would say most, are well schooled on how to provide those services virtually. So if you're looking to do some education or a tune-up for some of your leaders on how they can improve their leadership capabilities, rather than sending them to a leadership development training, you can have them sign up for some coaching, and we can help do that. Obviously, as a result of this session, we're going to continue to share information with our clients about what we're learning and what are some tools they can use to not only manage, Les talked about the medical implications of the coronavirus, but his top 10 list was clever, and I think speaks to the importance of managing the emotional side of dealing with the coronavirus. Some of you may know that I have hosted an executive book club in Bethesda. This will be year 5. In Hampton Roads, this is going to be year 2. And so we're just getting ready to relaunch those learning cohorts. And one of the things that I thought we could do, and we will do, is we're going to offer both of those book clubs available for executives at no charge. The caveat is everyone will have to order their own books. We'll assuredly host the first session remotely. So I know most of you are in the Washington, D.C. area. I see some people are from the Hampton Roads area. I know we've got one person logging from Columbus, Ohio. But if participating in a book club is something that you're interested in, we're going to do it for free this year, and just let me know. The next thing is providing some webinars. So again, one of the things that we're blessed with at Boxer Advisors is we have access to a lot of resources. And so one of our clients asked me this morning, and we're going to respond to him tomorrow, providing him a menu of webinars that we can do, 60, 90-minute webinars that we can deliver for him and his organization in the next 60 days, just because obviously most of their people are remote. And then the last thing is there are some lower cost solutions that we can offer our clients. If you want to talk about that in more detail, you can call me, email me. I'm happy to talk about them. I'll just mention 2 today. I know Les is disappointed. I'm not going to do 10, but the 2 solutions that we have provided, I think are pretty interesting. One of them is one of our partners is the tape rental library service, and they have access to a whole catalog of audio tapes, videotapes, and CD-ROMs, and they can do a custom catalog that is tied to your competencies. The second thing is, I imagine most of you have attended training sessions where they use a movie clip. The reality is, when people go to training using movie clips, I would say 98% of the time, they're using those movie clips illegally. They don't have the rights from the studios to use them. There is a colleague of mine who has a new company called movie.com, and he's got legal rights to use these movie clips, which can be either used in training or in these times can be used to support the communication of senior leaders. So if you're someone who is a sports fan or an athlete, or you've got other athletes who support you and you want to send out some emails with some movie clips, this is a great way to do that. So those are some ways that we can help support our clients. I know we've got 10 more minutes left. So we'll pause and answer some questions for about 5 minutes. Les, the first question is for you. You ready?
Okay. Yep.
So if I come back from the pharmacy with medications in a bag, how long will potentially the coronavirus live in the bag, or the receipt? Is there anything that I can be doing or should be doing to manage when I get medications and a receipt from a pharmacy? What should I be doing?
Interesting. Paper and kind of absorbs the virus, and but a lot of that stuff is going to be like a less absorbent type of paper. If you're really concerned about the possibility, I would just wipe it down with a bleach wipe or a Lysol wipe or something to that effect, or just open the bag and wash your hands and then before you touch what's inside, the medication itself.
Gotcha. And I assume, Les, the same would be true if you go to the grocery store and they give you a plastic or paper bag, if you're concerned about the same thing, yes?
Correct, yeah.
Okay, all right. Great. The next question is, and I've heard this less, the question is, if you live in a household and you think that someone might have the coronavirus, what should you do? I've heard different things about that.
Well, I think the problem is that if you're in the household and somebody gets sick, they may have had the virus before they showed symptoms. So you would almost have to assume that everybody in the household potentially is ill, or at least is carrying the virus, and you're all going to have to self-isolate for the 2 weeks.
I see. Can I ask a follow-up question? Is that all right?
Yeah.
So if that's the case, literally, would everyone in the household need to sort of go to their own room? Is that what you're suggesting?
Well, no, I think that if everybody's already exposed, you're not going to expose anybody else.
I
You know,
see.
if you know what I mean, it's a
Yep.
closed community, so to speak.
Yes.
So I think you just live your normal life, just everybody within the household. But
Yep. Gotcha. So Les, I'm going to ask you another question came in from one of our participants, and I know, uh, you know, I mean, you're my Anthony Fauci or Sanjay Gupta. I suspect that there's no easy answer to this question, but I'll go ahead and answer it. So how, given what you know, again, you've forgotten more than all of us combined will know about infectious disease. Given what you know today, do you have any sense about how long it will take until we reach a sense of normalcy again? That's one question. Then I'll let you answer, and then there's a second question.
well, I'm not, I mean, I may be an infectious disease expert, but I'm not a pandemic expert. I'm not an epidemiologist. So what you hear is basically that it could be a month to up to 3 months before we actually start to see this dying down. And it could be a lot longer than that before it goes away, if at all. You know, it's part of this is that the virus may not go away as the weather gets warmer for us.
Gotcha.
And even if it does, it may come back once we get through the summer. So if you're not aware, the influenza pandemic of 1918, otherwise known as the Spanish flu, first, it didn't start in Spain. It actually started in Kansas City, Kansas, at a hog slaughter house that was next to a military base, and American soldiers, doughboys, went off to fight in Spain. And that's really what started it. So it started in, then died out in the springtime, but came back the following November. And actually the second go-round was actually more deadly than the first go-round. So we may be living with the virus for a long time, but hopefully the acute phase will run the majority of its course, hopefully within the next 2 to 3 months.
Gotcha. Les, we've got 3 minutes left and a couple of questions. So someone asked, it sounds as what are we going to do to take care of, it says yourself. I don't know if the question is, what are you doing to take care of yourself during this pandemic?
3 things mostly.
Yep.
I'm washing my hands. I'm washing my hands, and I'm washing my hands.
I've got a question, Les. Are you washing your hands? Gotcha.
Yeah.
Yeah, gotcha. So
we were supposed to go out Monday night to a wine tasting dinner, and we canceled that. We don't have any major plans for entertaining in the next couple of weeks, and we'll just play it by ear.
Yep. So I told Les before we logged in that I happen to see someone on LinkedIn, and I'm going to host a virtual wine and cheese celebration. So if that's of any interest, anyone let me know. So one last question, and then we'll try to finish up. So someone said the city does not allow part-time staff to be paid during the closure. And so, like they do full-time staff. So how can we soften the economic hardship and help them work through the feeling of unfairness? So I would say, again, we've just got a few more minutes. So I would say 3 things. One, I think you can, try to be empathetic with them and try to help them understand, the policies and procedures that the city has. Second, you could, I know there are people who do, financial planning workshops. It's possible to do that for some of the people, helping them manage their money during these crazy times. And then, again, hopefully, I've heard a number of things about what the federal government may or may not do. Last question, and then again, if people have any other questions, just send me in an email, and if there are questions for Les, I'm assuming Les, you're willing to answer them. So the last question we have is, will the warmer temps lower the number of cases?
Well, the hope is that it will be beneficial. The main reason is once the weather gets warmer, you tend to go outside. You're not crowded indoors all the time. And that's the real thing. It happens to be a transmission. So just go outside, do what you need to do, but stay 6 feet away from somebody else.
Gotcha. All right. So we're gonna, just because we have another session at 4, we're gonna end the session. I would ask everyone to think about what's one thing that you learned or confirmed from today's session, and what's one thing that you're going to do as a result of the session. Again, if anyone has any questions, please shoot me an email. I know Sarah has provided information about our next webinar, which I believe, Sarah, I think is March 30th on action learning coaching with B. Carson. And so if you know nothing about action learning coaching, I would say register for this session. Before we end, I want to thank all of you for participating, and a big shout out. Les, thank you so much for agreeing to do this. I think you were really, really helpful and informative, and I appreciate you doing this. And I would ask all of you, again, if you have any questions or frankly, any suggestions about what are some things that we can be doing to support you, our clients, please drop me an email or call me. I think during these times, while we may not be able to be with each other in person, we can stay connected with each other technologically. So Les, again, thank you. Sarah, thanks for being the best administrator of these sessions. And with that, that's the end of today's webinar.